Hi there, my name is Heather Happy and I'm the esthetician at Cool Springs Plastic Surgery, and we are prepping to do a ZO 3-step chemical peel on our patient Crystal. And right now all I'm doing is just putting an Aquaphor barrier around her eyes, nose, and lips to protect this area from the chemical peel. Crystal is getting married in several months and she wants to try and get her skin as healthy as possible prior to her day. So because she's still somewhat in the sun, we are opting for a chemical peel. She still has to be out of the sun for about 5 to 7 days after the treatment, but not quite the restriction that we would have for lasers or other treatments that we've talked about. So what we're going to work on with this chemical peel is we want to work on her pore size, the oil content in her skin. We want to start working on the texture of her skin, making it soft and smooth. This is going to work on finer lines and wrinkles. It's just going to make her tone be a lot more even and more of a glowy complexion. So this is going to be her first step with an in-office treatment to address these areas. Crystal has already started using some really good skincare products at home that are going to be appropriate for her skin type and the issues that she's concerned about. So we find whenever we have an excellent skincare routine and in-office treatments, that is going to give our patients the best result. So Crystal has an air conditioning fan on. This is actually from our laser chiller, and she is using this because this chemical peel is really hot. I had it done back in May and it was pretty hot, but my fan was a lot smaller than this one. So she's going to use this to help calm her skin down. Crystal, in about 30 to 45 seconds, you're probably going to start feeling hot. For our other locations that doesn't have this kind of chiller equipment, we do have larger fans that we use, and that also really helps calm the skin down because this is a hot peel. It's hot for about 2 to 5 minutes. The goal is for me to use the entire contents of the chemical peel. So she is going to keep staying hot until I'm done with this little cup. You can start to see her skin is crystallizing. So that's what some of this white area is on her face. The acids that are in this chemical peel are actually starting to react with the proteins in her skin, and it's giving us what's looking like a chalky or crystallized appearance. I get asked a lot if we can do chemical peels on other parts of the body, specifically on the neck and the chest. And while there are some chemical peels on the market that are formulated for those areas, I don't like to put chemicals on the neck, chest, or even the arms or back of hands. The skin on those areas is so much thinner than the skin on the face, and that means that they absorb deeper and faster, more aggressively. And I have found when I have done it on patients that have requested on their neck or chest, they've gotten some reactions. So rash, redness, irritation, and it's something that I kind of like to avoid. So I would rather use topical skincare products on those areas if needed. However, she is probably going to peel somewhat on her earlobes and down onto her neck and up into her hairline, because these chemicals, even though they are applied to the surface of the skin, they absorb under the skin and spread. So she may get some peeling down on her neck, her earlobes may peel, and she may have peeling up into the hairline. Some of that is application, where some may just run a little bit, which is fine. But to cover the whole area multiple times with multiple passes of chemicals is just too aggressive, in my opinion, for those areas. So what I have just put on is a 6% retinol, and that is going to make sure that the chemicals absorb evenly, nice and deep. The retinol gives it a more intense treatment. And this is called Revitatrol. It's one of my favorite ZO products. I use it at home. This is a barrier cream. So Crystal, your skin should start cooling down here pretty soon. So this barrier cream is used whenever you have an issue with retinol products or something is burning or stinging your skin. This actually starts to protect and repair the outer surface of the skin. It's very soothing, and she's going to actually use this at home over the next 3 to 5 days to cool her skin down, help with itching, irritation, and dryness. I just really like to do a nice thick layer. Now these areas where she's a lot more white and crystallized, I will expect her to peel more in this area, which coincidentally, we took her photos on the Vizia Canfield camera that we have, and this is where she has a lot of sun damage, so I'm okay with her peeling more in this area. How are you doing?
Good.
Has it calmed down?
Yes, it's calmed down a lot.
Okay. Just gonna go around and wipe off some of your aquaphor. So for patients who have never had chemical peels before, the peeling process can be somewhat intimidating or just flat out scary. So basically within about 2 days, her skin is going to start to peel. It usually starts around the mouth because that's where we're the most expressive. So it starts around the mouth, then it starts to spread up and out. The nose doesn't always peel very much. There just isn't as much skin up there, but it'll start peeling up and out. She can't pick or pull at the skin at all. And what she'll probably notice is around this area of the eyes, she might see somewhat of a defined red line. That's where I had the aquaphor and the chemicals stopped. So you can see this white line from where she crystallized to where she's just pink. If that turns bright red and it looks like it's maybe burned, it's not. That's where the chemicals stopped before they could go past that area. So they absorbed a little bit more deeply here. Not a problem. We want to work on some fine lines around the eyes anyways, so that's going to help do some good exfoliation there. How you doing?
Good.
Okay, I'm gonna go ahead and sit you up. And then the fun part for me is having people see what they look like with this chemical peel. So we already talked about it before we started the treatment. She's going to be creamy, white, shiny, and yellow. So you can open your eyes and then you can take a look.
All right.
So what I was talking about, the white patches, that's where the product absorbed nice and deep. That's where you have a lot of damage. So I would expect for you when you're peeling, you'll probably peel more here than maybe up on the forehead. But you will probably have some peeling on the ear, maybe down along the neck, and then the peeling can come up into the hairline. Typically when it gets to the hairline is when you're about done peeling. And it can be a little bit of a nuisance. It might just look like flaky skin. So just kind of pick it out. Okay, how you doing?
Fine.
How's the heat? Cooling down?
Yeah, totally
Okay.
normal. Yeah.
Perfect.
Yeah.